Well, my name is Dr. Anthony. Anthony D'Angelo is my full name. I have my MD degree, which is why I'm a doctor. And so, as far as my experience in the field, I did work in medicine, and I have that experience. I've never actually worked as an RMA, but I've worked with RMAs, which gives me kind of a different perspective from the program. And we'll talk about it a little bit later, but that is one great thing about our programs. We do have a wide amount of knowledge and different backgrounds in our program. Just the depth of our program, the teachers that we have, which is something that I, am really proud of, is we have, lots of different backgrounds and lots of different experiences within our program. So we have people that are certified phlebotomists. We have people that are certified in coding and in office management. We have people that have worked in management of offices. We have nurses, we have doctors, we have PAs. We have this huge background of knowledge that really gives these students a great look into the field they're getting into. RMA program, we focus on multiple different skill sets. We have our clinical skills where we talk about how to assist within a medical office and multiple different specialties within the different medical fields, how you can assist in there and those actual clinical skills. We also focus on academic skills, such as your anatomy knowledge, physiology knowledge, medical terminology, and those things. And then we also focus a lot on the actual administrative or office parts as well. So we do coding and billing, we do front office administration, we do some actual back office administration, and things like that. When we have our students applying to the program, we have a lot of different backgrounds that come in, and we have a lot of different students that have kind of different plans for their future and what they want to do within the program. But one thing that I've noticed is our students that really tend to do the best are ones that really have that strong interest in medicine and principally in helping people, because that's what the medical field kind of yields itself to. And especially being an RMA, a lot of what they're doing is patient focused. So when we have those students that really have that desire to help people, they tend to excel in our program. Our last year's class, we actually had 3 students that entered nursing school, and all 3 of them got accepted and have started, and they're doing really well. So it's something that, makes us proud that we can say, hey, we gave them a really good background to get into something else they wanted to do. Did everything. We have students that are fresh out of high school, 18, 19, and then we have students that are into their, 50s, 60s. So we really get it all. And it's nice to have classes that have that much diversity because we really get to learn from each other. One thing I focus on when I'm teaching is I don't just sit up there and just lecture. I mean, that's not the way I do it. I like to be able to pull in all this knowledge from the class and be able to make it applicable for our students. And that's so nice when I have a wide range to pull from. We've actually changed some things over the past year of how we're doing our classes. A lot of it is we have our RMA focused classes, and then we have our classes that are more broad and can be applied to some of the other programs as well. And for some of those basic classes like anatomy and physiology and medical terminology, we actually combine with some of the other classes in the adult ed side and get to teach them with other classes, which again is nice because we get to combine people that are going into different fields and let them see some of the similarities, get them to talk to people that aren't in their program and learn with them. So that's actually a really nice thing that we've been able to do. When we're doing our actual medical assisting focused parts, we start in the mornings with our lecture section where we'll talk about whatever we're learning for the day. So for today in class, we're actually learning about the GI system. So we're going to talk about the GI system in the morning. We'll do our lectures. We'll do some stuff from a workbook to kind of really get that academic part down. And then after lunch in the afternoon, we get into the lab. and we do strictly lab stuff from the afternoon on. So we'll talk about assisting in either a basic thing like doing blood pressures and weights, or we'll talk about assisting today in the GI system and doing GI exams and talking about the different things you can see in the different tests. So we do about a 50-50 lab and lecture day. When we graduate our students, they are qualified. Probably, I guess, the most important thing for them is they're actually qualified to work as a medical assistant. They do get their RMA certification, assuming, of course, that they pass their exam at the end. But that will qualify them to work in any setting from an RMA. And then also there are a couple of situations, or I guess certifications, that are considered lower than that they can work at as well. So principally at Licking, where we do a lot of our placement, they have their point of care technicians that an RMA would definitely be qualified to work as that. And there's a lot of positions available in that. But they're also able to work, I guess, a step higher as an RMA. In our class too, we've also started to offer our students phlebotomy certification. And so we always taught phlebotomy in the past, but now we're actually allowing them to take the phlebotomy certification course, which allows them to be phlebotomy certified. So then that opens up that other door that they can actually work as a phlebotomist if that's something they prefer to do or they want to do. The earning potential really does vary. There are going to be offices where our students will apply where they'll try to lowball, try to offer a minimum wage or a little bit more. Obviously, if I was giving advice to that student, I would say, steer clear of that. I mean, you're worth more than that once you're certified. But typically we have a lot of variety. We have some students that entered in, they were getting offered, I think, $12 to start, and then they got a little bit of a raise after they were like fully trained in the office. And then we had some that started at like 17 or 18. So I guess it just kind of depends on where you're willing to work, if you want to stay here local in Newark, or if you're willing to head closer towards Columbus or some of the bigger cities where earning potential will go up. A couple of certifications for sure. The RMA certification is the principal one. We also offer our CPT, or our Certified Phlebotomy Technician certification. And then, of course, they'll get CPR certified as well, which is kind of the backbone of all of our medical courses. If someone is interested in the program, the first step I would say to take would be to contact the program. So Michelle Miller is our head of the program. They can contact her through calling C-TEC, or her information is available online as well. Once they contact her, she'll be able to either put them in touch with me or talk to them herself about kind of the program. We can start giving them a tour and really answering those questions, because a lot of people, they're not a cookie cutter person. They have different wants or desires. And that's something we can talk about with the person to see, is this a good fit for them? Because we don't want to just enroll students that maybe this isn't actually what they want to do. So we have a lot of options in the adult ed side of different programs as well that might be a better fit for them. And we're not here, to just take their money and, kind of stick them something they're not going to like. We want to make sure that they're in a field that they're going to enjoy. So we can talk to them and make sure this is the right fit. They can see if it's something they're really interested in. And then from there, we have a couple of additional steps. Obviously, applying to the program, getting things set up through financial aid if they're going to do that, taking their work keys test, which is a test that makes sure that they are maintain like the basic requirements to be able to succeed in the adult ed side and as well as in our program. And then once those steps are taken, that really gets them set up to start within our program. Great question too. It kind of depends. So we've done some different hours in the past. Right now our class is running Monday through Thursday from 9 in the morning until 4 in the afternoon. So they're pretty long days, and they are most days of the week. But we've also done night classes in the past, where we've done Monday, Tuesday, I think it was every day again, Monday, Tuesday, Wednesday, Thursday. We did it from 5:30 until 9:30. And because those hours are shorter, obviously that class will run longer. It ends up being a little bit over a year to get that class done. But there are those different options. Right now, we're just running the day class, mostly because we haven't had a huge interest in doing a night class again. But it is something that we definitely consider. We have the need and we have students that are working jobs but still want to get training that we consider doing. So.